Temporary Member Representative West. Any more subletters? Thank you. Madam Clerk, please call the roll.
Evans,
Here, present.
Andrade, Ugaste, Avalar, I thought I saw you coming. Bunting, Cassidy, Davis, Jed Davis, William Davis, Fritz, Gonzalez, Holbrook, Hernandez, Hoffman, Jimenez, Johnson, Jones, Mason, Moore, Olacall, Ortiz, Senalitro, Stava, Stevens, Vela, Weber, Willauer, Williams, West. We have 26 members present.
With 26 member present, we do have a quorum. We're going to start off with our Leader Ma. We've got a House Bill 4760. The chair recognizes Leader Ma to present House Bill 4760. I'll look for the witness slips. Please start your testimony.
Thank you, Chair Evans, members of the committee. House Bill 4760 was brought to me by Chicago Women in Trades. They were inspired by a bill that was passed in Washington State in 2024, and they brought the bill to me inspired by the language in that bill. And the aim of the bill is to ensure that construction workers who menstruate or express milk have a safe, sanitary, and dignified working conditions on construction sites, thereby fostering healthier, more inclusive and equitable workplaces. According to Chicago Women in Trades, construction work sites have historically not been welcoming environments for many women, and bathrooms have served as mechanisms for harassment and unequal treatment. Some women have even lost their jobs due to needing to use off-site facilities, which have led to claims that a worker took too long and became the grounds for firing. So what this bill does is that it requires separate toilet facilities for women and menstruating individuals on construction sites with 10 or more workers. It also requires construction employers to provide their workers who menstruate and with minimum sanitary conditions, and to provide their workers who are lactating upon request with reasonable accommodations needed to express milk. And finally, the bill authorizes employee-related inspections for noncompliance, prohibits employer retaliation, and establishes penalties for violations. We are also in discussion with a stakeholder who has some concerns and are working out an amendment to improve the bill. I have a witness here from Chicago Women in Trades to answer any questions. I would like to pass the bill, hold it on second while we wait for the amendment to be worked out. If you have any questions, Beth Berenson here is available to answer any questions. Thank you.
Thank you, Leader Ma. Do we have any questions from the committee? Yeah, do we have opposition? Yes, I'm sorry. Please state your name and start your testimony.
Yeah, good afternoon, members of the committee. My name is Noah Finley. I'm the Illinois State Director for the National Federation of Independent Business, a small business association. We represent over 10,000 small businesses in this state. We have concerns with this language. Our employers want to accommodate their employees. In this economy, we don't want to lose good employees. But that said, as currently drafted, we have some concerns about ambiguity in the language, some feasibility concerns, and then also the costs for small businesses. As the representative mentioned, we're having some productive conversations, negotiations going on at present. We look forward to continuing those. So I think I can end there, but I appreciate your support for small businesses.
Chairman Evans, members of the committee, appreciate the opportunity to speak. My name is David Ramirez. I'm here on behalf of the Associated Builders and Contractors of Illinois. Again, I want to reiterate what Noah said and appreciate the sponsor bringing this bill forward. We are in support of the concept, the idea. When it comes to implementation and the costs associated with this, there's a lot of work that needs to be done. We're hoping to continue to work out those issues and bring back a good piece of policy.
All right, thank you, and thank you, Leader Ma, for your great work working with folks in the opposition to try to make a good bill great. Do we have any questions from the committee? Real quick, I'll do the witness slips. I don't want to read all 46, but they're listed online. I'll just hit a few. The ACE Foundation, Lisa Aces, Lyra. We had Chicago Jobs with Justice, Angelique Marino. We have Chicago Women in Trades, of course, we see that. Illinois AFL-CIOs and supporters, Chicago Jobs Council, and many, many others. And opponents, we have 6 opponents. There's 46 proponents. 6 opponents include James Morphew from the National Waste Recycling Association. Of course, David Mears is here. And Noah Finley from the National Federation of Independent Businesses. So questions from the committee? Spokesperson Jugasi is recognized.
Thank you, Mr. Chair. Leader Ma, I just want to make certain I understood correctly. You said you're still working on language and you will hold this on second, correct?
Yes, we're working on an amendment. They in fact, have negotiations tomorrow. Yeah, we'll hold it on second.
Will you be coming back to committee then?
Sure, yeah.
Absolutely. Mm-hmm. Okay, I just want to make sure, because I won't ask any questions now if you're coming back. There's no need to do that.
Yeah.
Okay, thank you.
All right, great. Any further questions? All right, again, thank you for your great work on this legislation. We're going to move to a vote. Please add Representative. We received a substitution letter from Speaker Welsh. Permanent member Stava Murray is replaced by Stava, just Ann Stava, I didn't say that, is replaced by temporary member Rashid. I don't want to get in trouble. Don't y'all tell her I said anything other than that. Yeah, jeez. All right, we're going to move to a vote. There being no further debate, Representative. There being no further debate, Representative Jimenez moves that House Bill 4760 do pass. Is there leave? There being 18 votes in favor and 9 votes opposed to President House Bill 4760 is declared passed in favor of the reports of the House floor. Thank you, Leader Ma.
Thank you.
Thank you. Representative Rashid here. Representative Rashid with House Bill 4980. With Committee Amendment number 1. The chair recognizes Representative Rashid to present Committee Amendment number 1 to House Bill 4980.
Thank you, Chair Evans, Vice Chair Andrade, members of the committee. I am pleased to present HB 4980, which creates the Meaningful Human Control of Artificial Intelligence Act. Let me start by saying I intend to hold this bill on second and bring back an amendment after discussion with stakeholders. The purpose of this bill is to introduce guardrails around the use of automated decision-making in the public sector so that we can protect employees' jobs and workplace rights and ensure that decisions made by these systems are fair, accurate, and very importantly, always subject to human review. Many of you know I've spent a significant amount of my time in the General Assembly working on AI-related policy. One thing that's now absolutely indisputable is that the rapid, wide-scale adoption of AI technology is having and will continue to have a serious impact on workers. AI is replacing jobs and job functions, and without guardrails, we could see workers across our state deeply impacted by unrestricted and unchecked use of this technology. HB 4980 does a few things. It requires meaningful human oversight over any automated decision-making systems touching employment-related matters or decisions that could adversely impact public sector workers. It protects workers by requiring collective bargaining before any such system is deployed, prohibiting those systems from being used to eliminate jobs or strip workers of their duties. The bill also protects the public we serve and taxpayers by requiring human oversight of automated decision-making in the administration of benefits. If a system is found to produce biased or inaccurate outcomes, its use stops until that's fixed, and it bans outright automated decision-making in hiring, firing, discipline, and performance evaluation. We're in continued conversation with stakeholders, including the Department of Labor, Department of Innovation and Technology, Department of Human Rights. They are providing us feedback, including on definitions, and I will continue to work with them and others and come back with an amendment. I'm joined by Francis Ornick with the Illinois AFL-CIO to provide testimony in support and, on behalf of Labor, and Deirdre Darnell with AFSCME, who can answer technical questions. I'm happy to take questions. Thank you.
1 second, Representative Sheed, would you like to adopt the committee amendment?
I'm sorry, yes, I'd like to adopt the amendment.
Representative Sheed moved that the committee do adopt committee amendment number 1 to House Bill 4980. All those in favor say aye. Opposed, say nay. The ayes have it. The amendment is adopted. Continue with the amended bill. The chair recognizes Representative Sheed for House Bill 4980. He accepts the amendment. Continue, Francis.
Thank you, Chair Evans. Good afternoon, Chair Evans, Minority Spokesman Ugaste, and members of the House Labor Committee. My name is Francis Orenick, and I'm the Legislative Director for the Illinois AFL-CIO. We represent over 900,000 workers in Illinois, including hundreds of thousands of public sector workers. The Meaningful Human Control of AI Act is a top priority of our public sector affiliates and of the state Fed. This bill aims to prevent misuse of automated decision-making systems in the public sector to ensure that decisions made by such systems are fair, accurate, and subject to human oversight. We see this as a path forward to ensure that we're protecting taxpayers and people receiving these services, as well as people working in the public sector to help deliver and make sure that Illinoisans are receiving the best benefits that they possibly can without some AI decision-making that's not beneficial to the public. So with that, I'll keep my testimony short, and Deirdre Darnell is here to answer any technical questions. Thank you.
Thank you. You got any questions from the committee? Well, I'll go to the witness slips. We have quite a few witness slips. I request leave to read all, but we have 176 proponents. Proponents include the Illinois AFSCME Local 31, many times, IFT, Illinois Federation of Teachers, Illinois Education Association, IEA, and many others. They're all listed online. Do we have any opponents? Listed as opponents, we have 12 opponents. Opponents include Illinois Chamber of Commerce, Illinois Municipal League, Chicagoland Chamber of Commerce, and National Federation of Independent Businesses. Are there any opposition for oral testimony? Okay. Just please state your name and who you represent today.
Good afternoon, members of the committee. My name is Taylor Anderson, here on behalf of TechNet. TechNet is a trade association that's a national bipartisan group of technology and innovation leaders. We are opposed to this bill as currently drafted. I know the sponsor has mentioned that he will be working on an amendment. I want to just highlight for the record very succinctly a couple of the issues that TechNet member companies have. The definitions in this bill are far too broad. It captures a whole host of daily activities that are generated with automated intelligence. So AI is very prevalent in all layers of our daily lives, and including in government bodies for use. So the definitions of this bill capture far more than just some of the decision-making that I think the proponents are worried about. There is a lot of costs that are going to be driven by this bill. And just real briefly, one of the things this bill does is it requires impact assessment every 2 years to be done on any new and current AI that's used at the public level. And so just as a quick example, I don't know how many members were in this committee last night for energy, but there was a long, lengthy conversation around Illinois' wetlands. And the Department of Natural Resources talked about how they were utilizing AI to survey Illinois' wetlands, and they were using the training. Well, this bill could potentially prohibit that use or make it very costly for DNR to continue using it because of the impact assessment that would be required under this. And then finally, this bill also contains a private right of action. And there's a lot of concerns, not only for the member companies, but also for public bodies that would be utilizing the services that would be provided to those member companies. So, you know, in summation, we're happy to hear that the sponsor and the proponents are going to continue to work on an amendment. We stand ready to work on an amendment with them. I also want to just point out that currently the Illinois Department of Human Rights is looking at putting together rules around the use of artificial intelligence in employment, and there's some concern about how those rules might interact with legislation like this. So happy to answer any questions. Thank you.
Do we have any questions from the committee? Spokesperson Ugosti is recognized.
Thank you, Mr. Chair. Mr. Sponsor, Representative Rashid, it's my understanding you said you're working on an amendment. Are you certain you'll be coming back with an amendment?
I expect to, absolutely.
All right. Are you holding this on second and coming back?
I am holding it on second, yes.
And definitely coming back one way or another? Because I want to know whether to go through thorough questioning now or wait until we know what we're dealing with.
I will be coming back, yes.
Okay, thank you very much. I appreciate that. That makes life much easier for all of us. One thing I do want to mention, I haven't had a chance to see all the definitions yet. When you're talking about immediately stopping or ceasing use of the function for inaccurate outcomes. I don't know how you're quantifying inaccurate outcomes. If there's one inaccuracy, we could shut down a whole system from providing services for many of our constituents until we make certain that one problem has been resolved. So I'm just throwing it out there for something to think about while you're working through your amendments. And if I see anything else, I'll be sure just to find you and talk to you. So thank you.
Thank you.
All right, thank you. Seeing no further questions, we'll move to a vote. There being no further debate, Representative Jimenez moves that House Bill 4980 do pass as amended. Is there a leave? Madam Clerk? There being 18 votes in favor, 9 votes opposed, and 0 votes present, House Bill 4980 is declared passed as amended. It will be favorable to the reports of the House floor. Thank you, Representative.
Thank you.
Representative West here, Leader West. The chair recognizes Leader West to present Committee Amendment Number 1 to House Bill 5208. Would you like to adopt the Committee Amendment Number 1?
Yes, sir. I would like to adopt Committee Amendment Number 1.
Leader West moved that the committee do adopt Committee Number 1 to House Bill 5208. All further the opposed say the NBC as have it, and the amendment is adopted. The chair recognizes Leader West to present House Bill 5208 as amended.
I'm sorry, Mr. Chairman, did you say I can present?
Yes, sir. Please continue.
Thank you, sir. Mr. Chairman, members of this committee, I appreciate you for indulging me. House Bill 5208 is about giving working people in Illinois a more humane, more understandable, and more workable bereavement leave law. Right now, our statutes are spread out and can be difficult to navigate. This bill brings those protections together under one framework called the Bereavement Leave Act, also referred to as Zachary's Parent Protection Act. At its heart, this bill recognizes a simple truth. Grief is not a personal inconvenience. It is a global human experience. No worker should have to choose between mourning and their paycheck. Illinois has been a leader on this issue since the original Child Bereavement Leave Act of 2016. And this bill continues that tradition by closing gaps, adding clarity and strengthening protections for all workers. What this bill does is organize bereavement leave into 3 clear buckets. The first one is preserves leave connected to a death of a covered family member. Second, it creates a clear section for extended leave after the death of a child. And third, it creates limited general bereavement so a worker can attend a funeral, make arrangements, or grieve the death of any person, not only someone who fits a narrow statutory definition. For family bereavement leave, the bill creates a size-based standard for employers. Employees working for employers with fewer than 50 may use up to 5 unpaid days in a 12-month period, and employees working for employers with 50 or more employees may use up to 10 unpaid days in a 12-month period. That leave may be used for funeral arrangements, grieving, or certain pregnancy and adoption-related losses already recognized in the Act. For the death of a child, this bill recognizes that deeper loss may require more time. This bill provides 3 work weeks for employers with fewer than 50 employees, 6 work weeks for employers with 50 to 249 employees, and 12 work weeks for employers with 250 or more employees. That leave may be taken continuously or intermittently in increments of at least 4 hours within 12 months after the employee notifies the employer of the loss. This bill also creates a modest general bereavement leave provision. It allows up to 3 unpaid days in a 12-month period for a death of any person. That matters because grief and obligation does not always stop at the legal definition of a covered family member. Sometimes a person who raised you or mentored you or stood in your life like family deserves that dignity too. House Amendment number 1 adds structure and clarity for employers as well. It restores the ability of an employer to request 48 hours advance notice when notice is foreseeable, reasonable, and practicable. It also allows employers to request reasonable documentation for leave while protecting employee privacy, especially for pregnancy or adoption-related events, by preventing employers from requiring the employee to identify the exact category of that event. So this is not a loose or undefined proposal, colleagues. This legislation creates clearer categories, timelines, and documentation standards, and clearer enforcement through the Department of Labor. It is designed to be more comprehensive for workers and more administratable for employers. This bill also consolidates existing law. It repeals the separate Child Extended Bereavement Leave Act and folds those protections into one unified act. That means fewer silos, less confusion, and more coherent systems for everyone involved. And finally, friends, this is about dignity. When people suffer loss, that should not force them to choose between grieving and keeping their job. House Bill 5208 says Illinois can protect workers while still giving employers clear rules to follow. It is balanced, it is compassionate, and it is needed. For those reasons, I respectfully ask for an aye vote. And Leader Ugasti, I just want to make sure you are aware, I do plan to hold this on second and come back to see you and to talk more about it. I heard today from the National Federation of Independent Businesses and the Illinois Chamber of Commerce, I heard from both today at the last minute that they have opposition. I want to respect their opposition and have conversations with them. And Mr. Chairman, I'm putting on the record that my expectations with our meetings is to have not only hear their concerns, but have suggestions and feedback so that we can move forward or moving forward with the bill. Again, I'm coming back at the second reading. I ask for a favorable roll call.
Thank you, Leader West, for your work on this bill. Do we have any here in opposition for oral testimony? Please state your name and who you represent.
Yes, my name is Noah Finley. I'm the State Director for the National Federation of Independent Business, representing more than 10,000 small businesses throughout the state. We have concerns with this legislation because it expands the mandate under the Family Bereavement Act to small businesses, even the very small businesses, 1, 2, 5 employees. And state law has long recognized differences between larger and smaller businesses, giving increased flexibility to smaller businesses. This puts a mandate directly on small businesses. Small business owners work with their employees to provide accommodation in special instances like we're talking about. They have small workforces. They know their employees. They can't afford to lose good employees either. They need flexibility and not mandates because they lack worker redundancy. Like they don't have a lot of overlap in employees. It's also important to note that by including these very small businesses in this legislation, in the underlying act, there is a private right to action, and so these small businesses would be exposed to that as well. So for these reasons, NFIB is opposed to this legislation. We're looking forward to working with the Department of Labor and Representative West on it, and hopefully we can come to a good resolution there.
All right, thank you so much. Any questions from the committee? Representative Cassidy is recognized.
Thank you, Leader West, for bringing this. Just a quick question to put in the bucket of things to think about before you come back and visit us again. As a Jew, in my tradition, the funeral would be 24 hours after the death. So that 48-hour window might be problematic from that perspective. So if you could contemplate that as you're looking at amendments, I would appreciate it.
Thank you for bringing that forward. We will definitely consider that.
Thank you.
Thank you.
Any further questions from the committee? All right. There being no further debate, Representative Menace moves that House Bill 5208 do pass as amended. Is there leave? Madam Clerk? There have been 18 votes in favor, 9 votes opposed, 0 voting present. House Bill 5208 is declared passed and will be favorably reported to the House, passed as amended, and we favorably report to the House floor. Thank you.
Thank you, and the members of this committee.
The chair recognizes Representative Favre Dias to present Committee Amendment Number 1 to House Bill 4565. I'll look for the witness slips. Please start your testimony.
Thank you, Chair Evans. Thank you. You got the Dias, right?
Oh, Dias, yes, ma'am. I had one thing. I want to adopt the committee amendment. So do you want to adopt the committee amendment?
Yes, but we are holding this on second anyways to bring it back. But yes, but please adopt the committee amendment.
Hey, Representative Favre Dias moves that the committee do adopt Committee Number 1 to House Bill 4565. All those favors say aye. Opposed, say nay. The ayes have it. An amendment is adopted. The chair recognizes Representative Favre Dias to present House Bill 4565 as amended.
Thank you, Chair Evans and members of the Labor Committee. House Bill 4565.
Excuse me one moment. Staff wanted me to be clear. I'm sorry, you're not on the committee. I need to do someone on the committee. Representative Jimenez moved that the committee do adopt Committee Number 1, the House Bill 4565. All those favors say aye. Opposed, say nay. The ayes have it. An amendment is adopted. The chair recognizes Favre Dias to present House Bill 4565 as amended. Please continue.
Thank you, Chair Evans. House Bill 4565 prevents the enforcement of non-compete and non-solicitation agreements for doctors, advanced practice registered nurses, and physicians' assistants employed by Illinois hospitals. Non-compete agreements create significant barriers to healthcare access by causing a break in the relationship between a patient and their provider. These agreements treat patients like customers of a hospital rather than individuals with a relationship with their doctor. When a specialist is forced out of a region by a non-compete, a patient with cancer or rare heart condition may have to wait months for a new in-system doctor to learn their case from scratch. Furthermore, Illinois is facing a massive physician shortage that these agreements only exacerbate. As of 2026, 89 out of Illinois' 102 counties are designated as health professional shortage areas, affecting over 3.6 million residents. When a doctor in a rural or underserved county leaves a hospital but is banned by a non-compete from practicing within the 20 to 50 miles, they are often forced to leave the region or the state entirely, leaving an entire community without that kind of care. Dr. Mila Norlin, an Illinois OBGYN, has had to sever ties with patients due to a non-compete and sums up the issue very well. Quote, non-compete agreements may have a place in protecting business interests in certain industries, but medicine is not a typical business. Patients are not trade secrets. They're not assets to be owned or restricted. They're human beings who deserve stability, choice, and access to the physician they trust, end quote. House Bill 4565 ensures that Illinois remains a place where healthcare professionals want to work and where patients can keep the doctors they trust. I ask for your support in protecting healthcare access for Illinoisans. I also have Dr. Michelle Brown here, who is an OBGYN, to provide testimony.
Thank you so much to Chair Evans and the members of the Labor Committee. My name is Dr. Michelle Brown, and I am an OBGYN that lives and works in Chicago. I also serve as the legislative chair for the Illinois section of the American College of Obstetricians and Gynecologists. I'm here to testify in support of House Bill 4565, which aims to eliminate non-compete agreements for healthcare workers employed by hospitals. Non-compete agreements are widespread among healthcare employment contracts. Data from the AMA suggests just under half of the healthcare workforce have non-compete agreements in their contracts. There are many reasons why non-compete agreements in healthcare care is problematic. They restrict patient access to care. Non-compete agreements that force healthcare providers to relocate or stop practicing in a region can lead to physician shortages and limit patient access. Additionally, non-compete agreements in healthcare increase healthcare costs overall. Estimates from the FTC found that banning non-compete agreements would result in $74 to $194 billion in reduced spending on physician services over the next decade. They also reduce physician and provider autonomy. Healthcare providers who feel trapped in unsatisfactory work environments due to restrictive agreements are more likely to experience stress and burnout, leading to early retirement or career changes. For these reasons, many states have moved to limit or ban non-compete agreements in healthcare, emphasizing patient rights and workforce mobility over employer control. 4 states, California, North Dakota, Oklahoma, and Minnesota, have a near complete ban on non-competes in employment generally. Delaware, Massachusetts, Arkansas, Rhode Island, Colorado prohibit non-compete agreements from applying to physicians at all. In Indiana, non-compete agreements are prohibited for any physicians who are employed by hospitals or working in primary care fields. These are just some examples of restrictions on non-compete agreements aimed at improving conditions in the healthcare workforce and the healthcare system more broadly that have been implemented nationwide. I want to share the stories of some of my colleagues and of patients who have been impacted by non-compete agreements. Many of these physicians wanted to be here today to speak about the harms that they have faced themselves, but because of busy clinic schedules filled with patients, they were unable to come today. But they wrote statements in support of this bill that I'd like to share some selections from. Take the case of Dr. Christine Doyle. She was an OBGYN in Dixon, Illinois, working for KSB Hospital. She prescribed birth control, performed tubal ligations, and delivered babies as part of her role. KSB was acquired in 2024 by OSF Healthcare, a large Catholic hospital system in the Midwest. As part of that acquisition, she was banned from prescribing birth control in her current role and prohibited from performing tubal ligations. This was a monumental change in her practice conditions. She was unwilling to work as a provider for women's healthcare with these restrictions. She considered leaving the hospital to work for a hospital nearby without these restrictions, but her non-compete agreement stated that she could not work for any other hospital within a 20-mile radius, preventing her from working at the only other hospital that was 18 miles from her previous place of employment. She had to move to Rockford, Illinois, 45 miles from her home in order to continue to practice medicine, and Lee County lost a critical member of the OBGYN team. The impact on patients is also real. I want to read a part of a statement on behalf of Jennifer Littner, a patient of my colleagues. She writes, I experienced firsthand how physician non-compete agreements can disrupt continuity of care. Shortly after my delivery, my longtime OBGYN left their practice and due to a non-compete agreement was forced to relocate to a new practice more than an hour away. I had established a trusted relationship with this physician over several years, both personally as their patient and professionally as a provider who referred patients to their care. Losing access to that established relationship during the postpartum period was frustrating and stressful, particularly at a time when continuity, trust, and familiarity with one's provider are especially important. Policies that restrict physicians from practicing within their communities ultimately affect not just providers, but also the patients who rely on continuity, accessibility, and established therapeutic relationships for safe and effective care. I hope these stories from patients and my fellow healthcare providers help to demonstrate the harm that non-compete agreements have in healthcare. Please vote yea on House Bill 4565. Thank you.
I thank you for being here and all your work in this space. Do we have any questions? Sorry. Representative Stava Murray is here. Please add Representative Stava Murray to the roll.
Thank you. I wanted to thank the bill sponsor for bringing this forward. As many people know, I'm no fan of non-competes, tried to get rid of them all, but I'm happy to get rid of at least some more. And I think that what healthcare, if they want to be for profit, what they have to do is use benefits and treat people right to retain their talent. And that's what I learned in the business world, is when people treated people like cogs, they had an expensive business model because they had lots of turnover. And when people valued their employees, when they paid them right, when they gave them positive feedback year over year, access to different resources, education, those are the things that keep employees there. And they're things that lots of companies and lots of medical systems have walked away of recently, particularly with the entrance of private equity having such a large voice in our medical space, where I think my doctor should have more of a say on my care. So I love this bill. Please add me as a co-sponsor.
Well, thank you, Representative Stava. Do we have any other questions from the committee? I'm sorry, do we have anyone here in opposition? The chair recognizes Mr. Dave Gross from Illinois Health and Hospital Association for oral testimony. Please continue.
Yeah, Dave Gross with the Illinois Health and Hospital Association. Thank you, Chairman Evans and spokesperson Agasti. And we have had our discussions with the sponsor, and she understands our concerns. And just a little context, this bill that she's brought forward is amending the so-called Freedom to Work Act. This was an act that was heavily negotiated between Illinois employers and organized labor in 2021. The law establishes salary thresholds and requires non-compete agreements to be reasonable both in terms of geographic scope and duration. And really, this balanced framework took effect only 3 years ago in 2022. It's working as it was intended because it is protecting low and middle wage workers who have no leverage in employment contract negotiations. What this bill does is target hospitals. It prohibits hospitals from entering into reasonable employment contracts that include non-compete agreements. And what we're talking about are employment contracts for highly compensated physicians that are the result of negotiations between the physician and the recruiting hospital. Physicians are represented by highly skilled employment lawyers, and they wield significant leverage in these negotiations because it is the hospital that's trying to recruit the physician. Both sides must agree to the terms and conditions, and any non-compete language that's included in the employment contract has to be fair and balanced. That's the case law, that's the law that's in the Freedom of Work Act. Both in terms of duration and geography. And really, if this legislation is allowed to go forward, there would be hospitals that are going to be reluctant to invest the considerable resources to attract and build physician practices if there isn't some agreed upon assurance that the relationship will grow and benefit to both parties over time. And the amendment was adopted, and it's interesting the amendment was adopted because what the amendment does is create an unfair playing field between private equity-owned physician practices and hospitals. So a scenario under this bill will be that Lurie's Children's Hospital will recruit a subspecialist, spending millions to develop that practice, to buy the equipment, to buy the staff, and then the private equity physician groups can poach that physician and then require that physician to enter into a non-compete contract. That's what this bill does. So I just want to warn the committee that there's serious consequences to this. And again, these are not the individuals that the legislature intended to protect when they set the salary threshold at $75,000. And Representative Stava's bill is probably more on point because she raises that income threshold and applies it across all industries. Really unfair to target one of the fastest growing industries in the state and hamstring one of the largest employers in the state. The other thing I wanted to add is that there's a disagreement, and I've heard this story a couple times with respect to the physician in Dixon. There's a disagreement on the facts there. I won't get into it today, but that non-compete was with the hospital. Was not with OSF, it was with the previous hospital. It's my understanding that she was released from that non-compete and that she did not want to work for a religious affiliated hospital. So I wanted to set the record straight on that. Happy to answer any questions.
Any questions from committee? Supervisor Ugosti is recognized.
Just so it's on the record, because I don't think you were on the record before when the discussion was going on, for the sponsor, you do plan on holding this on second?
Correct.
And there will be an amendment, definitely, or?
We are continuing conversations.
So you cannot commit to come back to committee?
Yes, I'm committing to coming back to committee. Yes.
Okay, so we don't need to go through this now because we don't know what it's going to look like in the end?
Correct.
Okay, thank you.
Representative Cassidy is recognized.
Thank you. Doctor, you clearly have some thoughts about the factual situation that was just shared. So for folks who weren't able to read your face, could you share the words that go along with that?
The non-compete agreement that Dr. Doyle signed with her previous employer, when OSF acquired that hospital, they acquired the right to enforce that non-compete, and she was not released from that non-compete agreement. There was a very narrow release from that agreement solely for the purpose of allowing her to volunteer at the Lee County Health Department to be their new family planning medical director, which was a volunteer role that doesn't see patients, and she's not paid for it. But when she thought about taking on that volunteer role, OSF said that would be a violation of your non-compete, and she had to spend $10,000 in legal fees with her employment lawyer to allow them to carve out that narrow exception so that she could volunteer with the health department. So the non-compete was fully enforced for her to go work at the other hospital in Lee County, and the only release that she got was that narrow exception to volunteer.
Chair, if I could also just respond, happy to take further questions, but I just also want to respond that I appreciate the Freedom to Work Act and that we set an income threshold. But what we are talking about here is a group of individuals who there's a special public interest in making sure that people have access and easy access to healthcare. And so just like lawyers are carved out of non-competes because there is a public interest to people having access to legal counsel, I would submit there is a unique aspect here for people to be able to have access to healthcare.
And if I could say one more thing, that there are many states where physician non-competes have been invalid for a very long time, most notably California, which has had basically no non-compete agreements in the whole state since 1872. And that is not a place where you see widespread disarray in hospitals being able to retain physicians. There's many examples of places where non-compete agreements are not enforceable for physicians, and you don't see mass chaos in their healthcare systems.
All right, thank you all. We received a replacement letter from Speaker Welsh, permanent member Jones, Thaddeus Jones, replaced by temporary member Representative Rashid. The additional questions you have? Representative Stava for a question.
I just had one quick question for the gentleman from the Hospital Association. I appreciate that you like my bill. They actually didn't go over the reason behind my bill, which I'm certain applies to hospitals as it applies to corporate America. And that's because of sexual assault in the workplace and sexual harassment in the workplace. And when there is sexual assault and sexual harassment plus a non-compete, It puts people in an impossible situation, particularly mothers of young children, who have to put food on the table for their babies and want to be a strong example for their children. And yet every day they go to work and they're cut down or they're touched in an inappropriate way. And these non-competes are holding primarily women hostage in hostile work environments. And that is why I proposed banning non-competes completely back in 2019. It's why I keep trying to raise the threshold, because I think that it's just a very unethical and gross practice. Thank you.
Thank you so much for your response. Any additional questions from the committee? Let me defer to the debate. Representative Menace moves that House Bill 4565 do pass as amended. Is there leave? Madam Clerk. Thank you. There have been 18 votes in favor, 9 votes opposed, 0 votes present. House Bill 4565 is declared passed as amended, and we fairly report to the House floor. Thank you all. We have 2 bills left. We're going to go to Vela. Representative Vela. The chair recognizes Representative Vela. You can present for your chair.
Thank you, Mr. Chairman. Yes, thank you. I'm presenting House Bill 2565. It is a minor change to the Unemployment Insurance Act that limits how long workers are disqualified from receiving unemployment benefits during a labor dispute-related work stoppage. Instead of being ineligible for any week affected by the labor dispute, workers would only be ineligible for 2 weeks, after which benefits would resume. There is still discussions happening, and Representative Ugasti, I will be holding it on second.
All right, we're going to just really quick. We have only 4 proponents, 5 proponents. The 4 proponents are the roofers, waterproofers, and allied workers, IBEW, State Conference will be a couple of them. Then for opponents, we have 5 of them: Illinois Manufacturers Association, Illinois Chamber of Commerce, the Chicken Association, National Federation of Independent Businesses, Chicagoland Chamber of Commerce. Spokesperson Ugasti is recognized for questions on this bill.
Thank you. To the sponsor, you said you're working on amendment and holding it on second. Are you definitely coming back to the committee?
I am.
Okay. Thank you.
Thank you so much. There being no further debate, Representative Jimenez moves that House Bill 2565 do pass to their leave. Madam Clerk.
18 ayes.
There have been 18 votes in favor, 9 voting opposed, 0 voting present. House Bill 2565 is declared passed, and we favorably report to the House floor. Thank you, Representative. And for our final item, we have Representative Johnson. Is Representative Johnson here? The chair recognizes Mr. Johnson.
Thank you, Mr. Chair and members of the committee. I am here today to present House Bill 4758, which addresses a growing unnecessary barrier to employment in our state. Across Illinois, job postings frequently require a valid driver's license, even when driving is not part of the job. That requirement is often used as a default screening tool, not because it's relevant, but because it's convenient. In doing so, we are unintentionally excluding qualified and capable individuals from the workforce. This impacts individuals with disabilities, individuals that rely on public transportation, people in both urban and rural areas, and individuals who simply do not need to drive to perform the job. These are people who are ready, willing, and able to work, but are being filtered out before they even have the opportunity. The bill is pretty straightforward. It states that employers may not require a driver's license unless driving is an essential function of the job, or there is a legitimate business-related reason for that requirement. It also ensures that job postings reflect the same standards. What this bill does not do, this bill does not prevent employers from requiring a license when driving is part of the job. It does not interfere with legitimate business operations. It does not remove employer discretion. It simply ensures that job requirements are relevant to the job itself. At a time when employers across Illinois are looking for workers, we should not be closing the door on qualified applicants for reasons unrelated to job performance. This bill will help expand the workforce by removing an artificial barrier while still protecting the employer needs. At its core, this is about a simple principle. If the job does not require driving, a license should not be required to get hired. And I have heard personally from many individuals who have done everything right, earned degrees, applied for jobs within transit routes, and shown reliability, yet still could not get hired because of a requirement that had nothing to do with the work. This bill gives those individuals a fair opportunity. It's a common sense, workforce-focused measure that promotes fairness while respecting employer needs. We do have an amendment forthcoming, so we are asking for passage. We will come back next week with an amendment that has removed a majority of the opposition. We also met with Noah Finley earlier today. We're awaiting their response. I do have Nicholas Boyle here from Access Living here to take any questions.
All right, thank you. Just state your name and your title.
Yes, Nick Boyle with Access Living, Economic Justice Policy Analyst.
Thank you so much for being here. Any questions from the committee? Spokesperson Ugasti is recognized.
Representative Johnson, you're definitely coming back as well?
I would not miss another opportunity to have you question me, Spokesperson Ugasti.
Thank you.
All right, thank you. Leader Hoffman is recognized.
I just would like to point out and thank the minority spokesperson for being so reasonable and not making us go through this twice. Thank you so much.
I concur. Thank you, Nick, for being here. There be no further debate. Representative Jimenez moves that House Bill 4758 do pass. Is there leave? Madam Clerk, what do we have? There being 18 votes in favor, 9 opposed, 0 on the President. House Bill 4758 is declared passed and be favored before the House floor. Thank you all. That's it, right? Double check. All right. There being no further business, the House Labor and Commerce Committee will recess to the call of the chair. Thank you all.